While depression is one of the most common mental health diagnoses across the world, it is also shown to be one of the most treatment resistant and one of the more chronic diseases. Fortunately, there are several different assessment and treatment interventions available to treat depression symptoms and suicidality. Most often, the treatment modality for depression is standard talk therapy, either in an individual setting or a group setting. This can range from weekly meetings to more often meetings such as an intensive outpatient setting. In more severe cases, medication intervention may have to be used, such as use of antidepressants. In the most severe cases, inpatient hospitalization may be warranted in order to stabilize and use medication intervention in order to curb the risk of suicidal and self-harm behaviors. In addition to talk therapy and hospitalization and medication, there are also several different assessment measures that are used to measure for depression and suicidal behaviors. One of the most commonly used assessment measures is the Patient Health Questionnaire 9, or the PHQ-9. This questionnaire involves 9 items that cover various symptoms of depression, including both cognitive, affective, and physical health symptoms. Each item is ranging from a score of 0 to 3, and clinicians use the scores to make a total and make an estimation of present risk factors. Another commonly used assessment is the Beck Depression Inventory 2, or the BDI-2. The BDI-2 also includes self-report measures of depression symptoms, ranging from cognitive to affective to physical health symptoms. Just like the PHQ, each item ranges from a scale of 0 to 3 for severity. Clinicians then use the scores in order to total them up, compare them to other respondents in order to determine severity of depression symptoms or suicidality. There are also more general assessments that cover depression and suicidality among other symptoms. One of the most commonly used measures for this is the Achenbach family of tests. This includes assessments for younger children, ages 6 to 18, which would be included on the Child Behavior Checklist. There's also available an Adult Behavior Checklist for older respondents. These questions involve various types of self-reports on various mental health symptoms, which include depression and suicidality. Research has shown good reliability as far as the ability to measure for suicide risk in these assessments. The advantage of those assessments is that there's various ways to administer them. They can either be filled out by the patient, a confidant with the patient such as a parent or family member, as well as other people who work with them frequently such as teachers and social workers. More specific to suicide is available the SBQR, or the Suicide Behaviors Questionnaire Revised. This questionnaire involves 4 items that all assess for different types of suicide risk, including thoughts and behaviors. Similar to other tests, these include scores that can be totaled up by a clinician in order to determine the current risk or severity of suicidal behaviors or thoughts. Along with assessment measures, there are also several types of CBT exercises, such as worksheets. The good thing about this is that, according to studies, CBT strategies are shown to be the most effective regarding working with depression, including symptom reduction and reduction of future risk factors. There are several different worksheets that can be used, and I have a few for example. One of the first concepts is the cognitive triangle. Basically, this is a way for patients to map out different aspects of their depression to see how they're related. As you can see, the triangle includes thoughts, feelings, and behaviors. Clients are instructed to pick either an activating thought, feeling, or behavior as it relates to their depression, and to fill this paper out in order to determine the relation between the three. This should be helpful in helping clients to make connections between their thoughts, feelings, and behaviors in order to determine better patterns of their depression and hopefully develop healthier coping skills in response. Another useful worksheet is the Unpleasant Emotions and Actions worksheet. In this exercise, clients are to write out feelings they experienced in the past or are currently experiencing, and then write down an action that they took in response to the feeling. After that, they are to determine whether the action that they took was helpful to them or not, or whether it made them feel better or made them feel worse. Hopefully this can connect a pattern of behaviors to their feelings in order to determine how helpful those behaviors are and hopefully to develop healthier behaviors in response to their feelings. Another useful tool is the Unhelpful and Helpful Thoughts tool. This is a more cognitive approach to addressing depression symptoms. For this exercise, clients are instructed to read over this list of common thoughts related to depression that are determined to be either unhelpful or unhealthy. Clients are also allowed to include a more unique statement that maybe fits with their experience better. Clients are instructed to go through this list and check off or mark each statement that they feel applies to them. On this side, you can see that there's a list of corresponding common helpful thoughts. Clients are to go through the thoughts that they checked off and then go to the corresponding thought in order to challenge any cognitive distortions or build a healthier set of self-statements. It's hoped through use of this exercise that clients will be able to more consistently challenge their cognitive distortions and build healthier self-talk in relation to their depressive symptoms. Now what I would like to do is go over some of the exercises that we discussed. In the next video, I will be going over the 3 exercises we have just gone over in order to show you exactly how we would do them with a patient and determine what it would look like to fill them out in real time.